The city's 4 warming centers are open for vulnerable residents.
But homeless advocates say there aren't enough shelter beds and more food, hygiene, and mental health support is needed. The problem, according to the executive director of Global Medic, is COVID restrictions, rising rent, and inflation is making it harder for charities and community agencies to provide that support. To discuss one solution proposed to City Council last night, we welcome to CP24 tonight Rahul Singh, Executive Director of Global Medic, Rafi Aaron, spokesperson for the Interfaith Coalition to Fight Homelessness, and Dr. Stephen Huang, St. Michael's Hospital Chair in Homelessness, Housing and Health. Thanks to all of you for being here. Rahul, I'll start with you. You presented this deposition to City Council last night, basically pitching the city to build more of these social impact hubs. So first off, explain what that means and how this works.
Well, the big thing is we know we have increased needs across the city. COVID's had such an impact, the affordability's out of control. And what's happening is it's double in price now to host industrial properties. So a charity that wants to provide services, its costs have doubled to just occupy space, which means if council gives a grant, to pay rent, that money is effectively worth half because the rent's going up. So what we're suggesting is if the city makes space available, think of Amazon-type warehouses where charities could then occupy and then do the work that they do, whether it's, food banks or furniture banks or agencies like ours that produce food aid and produce hygiene kits. We can have these super centers operating to then get more aid out to meet the more needs that we have. And you know what, for the last 2 years, it's been working at Cloverdale Mall. So we have a case in point where it is working, where the landlord's generous enough to give 5 charities free space. And we're saying to the city, listen, do the best thing that you can do, which is be the infrastructure provider and give us more space so we can do the work we need to do.
So what was the response, Rahul?
Well, you know what, the councillors seemed interested, but, it's hard to move the motions forward and get people on board. It's a very good idea, and I'm just hoping that the more folks that we can get listening to the idea and understanding that we need to do more and we have to do more with less, because let's face it, financial constraints are coming. I think we have a positive response, but it's a big effort, and we all got to get on board and just push it forward and get it done.
So, Rafi, you work in outreach. How bad is it out there right now? And what is social impact hub that Rahul's describing? Would that help?
This is the worst that I've ever seen it in 14 years of volunteering in the sector. We are looking at a humanitarian disaster. The Toronto shelter system has collapsed. And the only way that we're going to be able to really reverse any of this is to get the federal government in at this point in time.
In what role, Rafi?
Well, we need to get another 2,000 shelter beds in non-congregate settings up immediately. We need another 4 warming centers. We need another 2 recovery sites. We need them to staff, sites with people who have experience dealing with our community members. And so, and we need it done right away. Immediately. And this is just something that the city can't do. I mean, their rollout of N95 masks to the shelters has been extremely slow.
So, Dr. Huang, a few weeks ago, you tweeted about your level of concern about the shelter situation in Toronto. How are you feeling about this today as we're on day 9 of this extreme weather alert?
Well, I'm really concerned. The situation is quite dire for people who are seeking shelter beds. And we know this from our vantage point in the healthcare system. At St. Michael's Hospital's emergency department, we're regularly seeing people coming in who don't have any medical condition. They're seeking warmth and shelter. And we're also seeing a significant number of people presenting with cold-related injuries. Just today, 7 people came to our emergency department with frostbite and other cold-related injuries. There were 3 people who just came in simply because they needed a place to get warm. And unfortunately, we can't find places for people to go to. So 6 of the people who came to the ED left without any shelter bed to go to.
Wow. Raul, can we talk about the current grant system for charities right now? What isn't working there?
Well, I mean, listen, there's so much need. You know, council gives out money to 840 agencies, and is the money effectively spent, and can we do a better job to spend the funds? And at some point, you have to talk about economies of scale. If I give you a $20 gift card to go buy your hygiene items at, let's say, Shoppers Drug Mart, and you're paying $9 for shampoo, but I could run a program where I could get the price of that down to $1 because I could buy in bulk and repackage it into kits, we could do so much more aid delivery with less money. And I think that if you listen to what the other two gentlemen are saying, that there's a crisis on the front line, well, why don't we direct more money to get more beds and then trying to get some savings by consolidating spaces and get the savings where we can, because every time we put folks into beds, into the shelter system, every time we get them assistance, we also have to give them products as well, hygiene items, food, all the basics to keep people healthy and alive. So to me, it only makes sense to drive costs down and get more aid out and get the right aid to the right people.
Dr. Huang, I want to ask you about some of the work that you've done. You co-led what's being called the largest randomized controlled trial in history to basically evaluate solutions to address homelessness. So tell us about the findings there and how that influenced policy.
Well, we studied an approach called Housing First, where people who are experiencing homelessness can be immediately housed in apartment units using a rent supplement and with supports. And our study showed that this approach is highly effective in ending people's homelessness indefinitely, permanently. And the tragedy is that we don't have enough resources, enough rent supplements, and enough affordable housing to actually use what we know works to end homelessness. So in the long term, we really do need assistance from the provincial and federal levels to ramp up these approaches, housing first approaches to ending homelessness. In the short term, this winter, this week, we have an urgent crisis and we need more places where people can get warm. But the answer is not, in the long term, more shelter beds. It's to provide more affordable housing for people.
Yeah, and I wonder if you can speak to this notion of declaring a cold weather alert and having those warming centers open, and then when the weather eases up, we close those warming centers. Is it better to just keep them open all winter long, Dr. Huang?
We've done research that suggests that the risk of homeless individuals getting injured by the cold is pretty much occurs throughout the winter. And I think based on our findings, it would be better to keep warming centers open continuously during the cold months rather than doing it, expanding and contracting based on extreme cold weather alerts.
Mm-hmm. Rafi, you sent a letter to Mayor Tory, Chief Peg, Dr. Davila, about steps you'd like to see the city taking to address some of these issues. Have you received a response?
The letter was sent from the Interfaith Coalition to Fight Homelessness last Wednesday. It was signed by 97 people, clergy, congregants, faith groups, and we have as yet to hear anything from any of the three people who were sent the letter, which is extremely disappointing.
What were some of the things you were asking for in the letter? What would you like to see change here?
Well, aside from what we had said about, spoke already about bringing in the federal government, getting things moving really quickly, we want to see certain things done immediately, and one of them would be harm reduction. There are a lot of deaths in the shelter system due to overdoses, and the city's strategy on that has failed miserably. And so we want to see a complete overhaul of that and an expansion of education and just a complete new rollout that would save lives. We want to stop immediately the practice of admitting new community members into shelters that have outbreaks. We want to see enough N95s and rapid tests in the shelter system and that sort of thing.
Dr. Huang, the Ontario government had set a goal to end chronic homelessness by 2025. In your assessment, are we on track to achieve that?
Unfortunately not. We're nowhere close. We really need a redoubled commitment of resources. Otherwise, we're just going to be dealing with this situation year after year.
Raul, I wonder if you can speak to where we're at with this first social impact hub in Cloverdale Mall. Are you seeing more organizations, more social agencies coming together that want to be part of this?
Well, we're really lucky, you know, the space is there. There's 5 agencies that get to work together, share resources, are able to get more aid out. So it is working, and it's just would be smart of the city, or whether it's the province or the feds, to step in and then make more spaces like this available. The folks on the line right now are talking about the crisis and the fight that's happening right now. Well, we have to understand if we raise this to a macro view, we deliver our social services through social agencies and community agencies here in the city. And if their rents are doubling, it means they either leave the city and we lose services, or they shrink their footprint and we lose services. We can't afford to lose any services, so we're going to have to intervene as well and make sure these agencies have stable spaces to operate. And with COVID-19, where we have to decentralize and put fewer people in spaces, just like the shelters, we need more space to do this work. So if we don't take advantage of ideas like this right now, we are going to be so much further behind than we are now, and it'll be catastrophic.
Okay, a really important conversation. We appreciate your time. Gentlemen, thanks so much. Raul Singh, Rafi Aaron, and Dr. Stephen Huang, thank you.
Thank you.
Thank you.